Hi, good evening. My name is Dr. Joshi, and along with me is Dr. Ravi Shankar, who is a young, dynamic, and a very experienced endocrinologist. Works with the Apollo hospitals and Apollo Sugar. Today happens to be the sweetest day of the year, which is the World Diabetes Day. So we decided that why not have a good sweet chat with all of you and understand, is it good to be sweet, or we need to add something else in life to make it a little more balanced? Right, Ravi?
Yeah, that's a good one. Good evening, everyone. Good evening, Dr. Joshi. Thanks for having me here. Let's see what comes out from the audience, and let's try to interact with them.
Right. So the whole intent is my understanding of diabetes in Indian space and how people view diabetes is, I think, more than the illness, just like a lot of fairy tales, there are lots of myths associated with this particular illness. So if we can, alongside creating awareness about diabetes, if we can find a way of debunking some of these myths, I think that will be helpful. And I'll urge each one of you to come up with some of these things that you've heard from your uncle, from your relative, from somebody, from some Baba who said you drink the water which comes out of the roots of this tree, etc., or take this medicine, have methi 4 times a day, and other. There are so many things, some of which do benefit some people. There are definitely some people who would swear by it, but a lot of it has not stood the test of time as far as the scientific evidence is concerned. So my intent largely today is to quickly make you aware about some of the things about diabetes, and Dr. Ravi will help us debunk some of the myths that are associated with diabetes. Sujir, good evening. Thank you for joining. Jay Krishna, thank you for joining us. Nirmala, thank you very much for joining. Shavik, you have also joined. Shavik is from Calcutta. Thank you for joining. Lijo John, good evening. Thank you for joining. I do hope that you and your friends, your family are listening to this talk, because I do certainly feel that today it's more a norm than an exception about diabetes. I mean, if you have a family, some member will have diabetes. It is as simple as that. So here it is. Let me start by asking Dr. Ravi, till we get some more people who are joining in. Ravi, from a simple man's perspective, this is what people feel, and this is what I was brought up with. If you eat more sugar, you get diabetes. If you have more weight, you will get diabetes. So let's first debunk this.
Yeah, and that's a good way of starting the conversation, I suppose. If you look at the first question, which is, if you eat more sugar, will you develop diabetes? Yes, partly true and partly not true. Partly true because you're eating the wrong type of carbohydrate, which can probably increase the risk of developing diabetes because you're eating the wrong type of food in surplus. But partly not true because if you were to even have 2 extra spoons of sugar a day, but if you live healthily otherwise, as in if you don't eat junk food, other than that bit of extra 2 spoons of sugar, and if you were to do a good amount of exercise, those 2 extra spoons of sugar a day are not going to increase your risk of having diabetes. So it's partly true and partly not true, depending on how you see the bigger context. Coming to the second question, if you're overweight, can you develop diabetes? Yes, if you're overweight, certainly you're putting yourself to increased risk of developing a type of diabetes called type 2 diabetes, which is the most common variety of diabetes that we see across the world.
So my understanding is you are creating a plan for moderation in life, right?
I think just like anything else in life, you need to enjoy life, you need to relish the finer things of life, but at the same time you need to balance it out.
Great. So message number 1 is balance, and I'm going to be coming back to this word again and again as we go through this talk. Balance in your food, balance in your exercise, balance in your approach, lifestyle. All of these things are essential as far as diabetes is concerned. We will come to the next part of the story, and this is people always get confused in terms of what is type 1 and type 2 diabetes, right? And there is so much of importance, emphasis that is given from a layman. I can understand from a medical standpoint this is important, but should lay people know and spend so much energy on understanding what is type 1 and what is type 2?
I think so. The reason being, it helps us understand who needs insulin, who needs to immediately seek medical attention, who should not stop insulin, so on and so forth. So let me start with some basics. What is diabetes? Diabetes is nothing but a condition wherein the blood sugar levels are more than what they should be. So in simple words, if the blood sugar levels are high, you end up having diabetes. But why does that happen? Because we all have a gland in the body called pancreas, which secretes a chemical or hormone, which we call as insulin, which is very much essential for the cells in the body to take the glucose in the blood. If at all the insulin is not secreted adequately by the pancreas, or if the insulin that is secreted is not utilized by the body efficiently, then automatically the blood sugar levels increase and the person develops what we call as diabetes. Diabetes has been divided into two subsets. The first type is called type 1 diabetes. Usually it develops in children. It can also develop in adults and also in old age, but rarely. So usually type 1 diabetes develops in younger individuals, kids, and it is because the insulin is not being secreted by the pancreas at all. That means these individuals need insulin immediately. They can't wait any longer. If they wait any longer, they can even go into coma and die. So that's the reason why people need to understand the difference between what is type 1 diabetes and what is type 2 diabetes. When we speak about type 2 diabetes, it is that type of diabetes that usually, again I repeat it, usually develops in elderly people and in adults. But it can rarely develop in adolescents as well because of the increasing prevalence of obesity in young adults and adolescents.
Okay, so just to recap what Dr. Ravi just mentioned, type 1 is where, usually right from a very early age, your pancreas are not producing insulin at all in your body, and therefore it has to be substituted and given to you immediately. Right. Type 2 is where insulin is being produced, but it is not as effective as it should be, or there could be other factors which are modifying the effect of insulin, or you are eating too much of sugar, which is beyond what the insulin that is being generated in the body that can balance.
Yeah, you summated it very well. Just about type 2 diabetes, most of these individuals do have insulin in the body, but it's not sufficient enough for them to live healthily.
Right. So, just a one cap thing, it's a problem with one of the hormones in the body called insulin. Either it is not there, or whatever is there, it is inadequate to control your sugars.
That's a good way of summarizing.
So now, having understood this, I want to come to the next important thing, and I see this very often that people say diabetes lifelong rahega, and they get bogged down with this. This is the first thing.
Yeah.
The second thing which I am very much concerned, and I talk out of my experience of dealing with a father who was diabetic for over 25 years, 30 years, and I saw him taking insulin 3 times. But there is so much of resistance of this word called insulin. It is only when everything else in the world fails that people want to try insulin. What would your advice be, Doctor?
Right, you asked me too many questions in one question. Let me try to dissect them, Dr. Joshi. The first question, do you live for the rest of your life with diabetes if you develop diabetes? If it were to be type 1 diabetes, more likely than not, or 99%, you will end up living with type 1 diabetes for the rest of your life, unless you have a rare surgery like pancreas transplant or islet cell transplant, which is very rare thing. So by definition, if you develop type 1 diabetes, which is a condition wherein there is no insulin production in the body, you will have to live with the word diabetes for the rest of your life. But if it were to be type 2 diabetes, I'll give an example. If it were to be a 100 kilo, 40-year-old adult who developed type 2 diabetes afresh, and he has been living a very unhealthy lifestyle, no exercise, no diet control whatsoever, eating all garbage, what he finds across on the bazaar. And if this chap were to be educated properly, if he were to change his lifestyle completely for good, i.e. start doing exercise regularly and eating the right kind of foods, i.e. green leafy vegetables, and cutting down on his carbohydrate intake, there is a likelihood that he can turn into a non-diabetic by shedding, say, 20-30 kilos over a span of 1 year. So there is a likelihood that you can reverse this phenomenon of type 2 diabetes into a normal, non-diabetic state if it were to be type 2 diabetes and if it is acted at the right time, in the right context, under right supervision.
Great and very important point Dr. Ravi has brought in. Don't get bogged down with diabetes. There are enough examples. You know Wasim Akram, cricket player. There are so many sportsmen. There are so many film stars. There's so many cricket other anchors that you see on television that have diabetes, and they continue to lead even some of the most demanding kind of lifestyles. So we should not get bogged down, and there is a fair chance that if you are sincere towards your balance and your dedication is utmost in terms of diet, exercise, lifestyle, etc., and discipline more importantly, then there is a fair chance that you will be as good as normal, or probably you can, if it is detected early without any target organ damage, you might be able to reverse the process of type 2 diabetes.
Yes, you can.
So there is hope to, win over this. Don't just give up saying that diabetes ho gaya, iske aage kuch nahi ho sakta hai. So having talked about this diabetes, two important aspects, I want to come to the next. So what if there is diabetes? So what if there is high sugar? What is the worry? What is the big worry? There are people who live with 120 sugar, people who live with 400 sugar. I've had my dad who, for many years, he used to take insulin, but he used to eat his poha along with a spoon of sugar post that. So many of our parents are diabetics and they are old generation. They have led a certain lifestyle. They don't want to change. So what is the big worry? I think this is something which people don't understand. They only run after the blood sugar values of fasting and post-lunch. What are the worries in terms of that?
Yeah, let's again dissect this into two entities. One, what happens in terms of symptoms? Do you feel well or do you feel unwell if you have very high sugars? What happens is when the blood sugar levels are very high, you tend to feel tired, extremely lethargic, no energy levels whatsoever. You start going to the loo very often, sometimes even every hour. You end up waking at night times, say 3-4 times to go to the loo. You really have every symptom on earth that makes you feel tired. So this is about what happens immediately. But let's imagine that you ignore these symptoms and you think, let's see what happens later in life. I'm okay to live with these symptoms. It's not just that you're going to have these symptoms, feel naked, feel tired, but you're going to develop a lot of complications pertaining to diabetes, which can affect every part of the body, starting from your eyes to your heart, brain, go down, you have your kidneys. If it is men, it can cause erectile dysfunction. That means inability to sustain a proper erection, i.e. problems with sexual life. Then you go down to your kidneys. The kidneys can get spoiled as well. And then when it comes to your nerves, you can develop burning sensation of your feet, which is called as neuropathy. That means you are unable to walk properly on the surface of the floor because you feel as if you've got pins and needles, or you lost your sensation of your feet absolutely. So you can develop every problem on earth. And in medical terms, as you very well know, we call it nephropathy, neuropathy, retinopathy, heart attacks, brain strokes, and even problems with liver for that matter, what we call as fatty liver.
So I think it's important for all of you to know that diabetes per se doesn't kill anybody, but it softly keeps on killing the organs in the body. And the fundamental reason for this is it starts attacking the pipelines of the blood vessels which are supplying these important organs. The smaller and thinner the blood vessels which are supplying these organs, the earlier they start getting the problem into the body. All right? It is as simple as that. So it is not just about blood sugars. I think for diabetics who are detected early, they should be first worried about, is there a target organ damage? And the important targets that we are talking about is brain, eyes, heart, then you have kidneys, and then you have peripheral circulation and the nerves. These are the 5 important areas. So if somebody gets a fasting and post-lunch sugar done and it comes high, you should not stop there. You need to go to a specialist. Your eyes need to be screened. Your kidney function needs to be assessed. The larger problem in India is this: now people have become aware about blood sugar levels. People are detected to be diabetes, but their target organ detection gets delayed for a couple of years. And that's how you see so many people ending up on dialysis or losing vision. So it's very, very essential for each one of you to know about the target organ damage. The other important thing that has happened with lots of packages of healthcare packages and testing that is coming out is HbA1c, and everybody is running after HbA1c. You want to throw some light on HbA1c?
See, as you rightly mentioned, most of our older generation have been struck with this thing called fasting and post-lunch, or fasting or post-breakfast blood sugar levels. But as you have already mentioned, there is a lot more to it than just fasting blood sugar levels and post-breakfast blood sugar levels, because there is something called HbA1c, which is an average of the blood sugar reading over the previous 3 months, and it gives us a real good idea as to how the blood glucose levels have been over the last 3 months. On the contrary, if you were to just go by the random blood sugar level or fasting blood sugar level, that gives only a snapshot of the blood sugar level at that particular point of time, and it might as well be very good at that particular point of time, but the blood sugars could have been very bad the previous day, the previous month, the previous week. And the only way we get to know as to how the overall picture is by doing this test called HbA1c, which is alternatively called as glycated hemoglobin.
It's interesting because I remember my dad doing very good control 1 week before he was going to follow up with the doctor.
Absolutely.
And I'm sure most of your patients do that too, right?
Some of the patients, they're scared that, they come to the clinic, they think that they get told off if the blood sugar readings are high, so they do that.
So we've got some questions from the audience. I just want to quickly take, what is the chance of diabetes to kids of a diabetic father?
So it's a very interesting question. It depends on the genetic makeup of the individual who has developed diabetes, whether it is type 1 diabetes or whether it is type 2 diabetes. Studies have shown that type 1 diabetes can be inherited, so can type 2 diabetes be. But there are a lot of genes that affect if an individual can develop diabetes or not. We can't simply say, look, the chance is 50% or 30% or 100% at this stage, but suffice to say that if parents do have diabetes, then the chances of the offsprings developing diabetes is certainly more than a family wherein the parents do not have diabetes.
So, Rizwan, to your question, the simple message is, if any parent has diabetes, there is a higher risk. So you have to start early in terms of your diet, in terms of your discipline, and also in terms of your checking up of things. Whether you are diabetic, pre-diabetic, etc. You will need a little more rigorous follow-up on an yearly basis to check whether you are developing diabetes.
Yeah.
So that's one. Second one is, what are the required food habits which can help to beat diabetes apart from medication? And if I were to give you option between drug, diet and discipline, let's look at what is the proportion of these 3 things in managing diabetes.
I suppose when it comes to using the word discipline, it incorporates both drugs as well as exercise, as well as diet, isn't it?
Yes.
So I think discipline is the key word in any of the lifestyle diseases, more so for diabetes. Because if one were to be disciplined with taking the medications as advised, if one were to be disciplined maintaining regular follow-ups with the physician who is delivering healthcare regularly, periodically as asked, if one were to embark on a proper exercise regime, if one were to make sure that they eat the right kind of foods as advised by the dietitian, and they take care of themselves, getting their eyes checked periodically, make sure that they don't get any ulcers or broken skin of the feet, then everything is sorted. So the magical word here is discipline.
So we talked about balance, we talked about discipline. I'm again reiterating. Now coming back to food habits, now there are lots of big don'ts that are put the moment somebody is diagnosed with diabetes: no rice, no poha, no rice items, etc. So is it true that people have to follow it like that? Or what are the things which are completely no, what have to be taken in moderation? Quickly, if you can tell this to our viewers.
Yeah, before answering that question, we need to remember that there are three chief constituents in our food. One is carbohydrate, second is fat, third is protein. Carbohydrate examples: rice, your wheat products, so on and so forth. Fat, simplest example is oil, ghee. When it comes to protein, examples are egg white, fish, dal, etc., etc. So what increases blood sugar immediately is carbohydrate, especially if it is that type of carbohydrate which is easily broken down as soon as you eat, such as your white rice, such as your what we call as the white or the non-whole meal flour of wheat flour. These are the sort of things that we advise to cut down on. Instead, you can take brown rice. Instead, you can take whole atta that is available in the market. And when it comes to protein, there are no restrictions as such. You can eat chicken, you can eat egg white, you can eat fish, as long as you don't add the third variety of nutrient or constituent of food, which is fat, because it immediately does not increase your blood sugar levels, but in the long run, it causes obesity, which promotes insulin resistance, i.e. your blood sugar levels automatically go up, and also it can cause heart attacks, brain strokes, so on and so forth. So in one simple word, yes, you can take rice, but in limited quantities. It is preferable not to take white rice. It is preferable to use brown rice or less polished rice that is available in the market. You can take wheat flour, but not the refined one, but the whole atta that is available, that too in limited quantity.
Great. So just reinforcing this point, many times people think that hum goli le rahe 2 baar, so why so much control? And then you continue with the normal diet, that 2 tablets is becoming 3 tablets. But that's not the way of doing it. I think every diabetic, as much as it's important for you to have a physician taking care of you, you also need to have a dietitian who works alongside with you. It is fundamental. We tend to neglect this for quite some time, and you'll be surprised on how well diet and exercise helps you in reducing the quantum of medicine over time. At least it will not be escalated further, and over time, if you add good exercise into this, definitely your medicines that you're taking would come down, or dose of insulin would come down. Now, there are a couple of other interesting questions that have come. One is about pregnancy and diabetes, gestational diabetes. I think it's a relevant question because we have a lot of young working couples and the incidence of diabetes is going up. So just throw some light on gestational diabetes and pregnancy-induced diabetes. Yeah.
See, when it comes to discussing diabetes and pregnancy, we can speak for hours together, but because we don't have that much time, let me try to put things in a nutshell. If someone were to have diabetes, whether it is type 1 diabetes or type 2 diabetes, the key message here is that one needs to plan the pregnancy. They can't just let the pregnancy happen without getting a clearance from the obstetrician or the endocrinologist or the diabetologist taking care of them, because unplanned pregnancies are the disasters. So the first message here is plan your pregnancy. Especially if you have diabetes, that makes it a very valid reason to plan the pregnancy. The second thing, even if you didn't have diabetes in the past, the chance of developing what we call as gestational diabetes is very high in Indian women, just because of the sheer genetic makeup of the Indian woman. Hence, every Indian woman needs to get screened for what we call as gestational diabetes, or a particular state wherein the blood glucose levels increase whilst the person is pregnant. So there are two separate aspects here. Even if somebody didn't have diabetes before pregnancy, they are at high risk of developing what we call as gestational diabetes, thus they are pregnant. And this very gestational diabetes or diabetes per se can increase the risk of fetal malformations, can increase the risk of large babies, making delivery very difficult, and causing other problems pertaining to labor, and also in general, if at all this were to be not taken care of adequately during pregnancy. Hence the reason every pregnancy ought to be planned, especially if they have diabetes beforehand. Even if they didn't have diabetes beforehand, they need to ensure that they are screened for what we call as gestational diabetes as advised by their obstetrician. If they were to follow these simple steps, then it would be a healthy mother and a healthy baby.
Interesting. I think just for the want of this screening, people land up with last minute emergent things and complications. They're looking forward to something which is so precious, and it ends up into a disaster. And only you have to be blamed for it. I think it's just a matter of awareness on your part, and also sometimes the healthcare providers who do not insist on some of these elements. I think it's an important message, because this is something so precious that the family is looking forward to. And importantly, many times gestational diabetes after delivery tends to settle back to normal, right?
In vast majority of women, they don't need any medications immediately after the delivery if it were to be gestational diabetes. But having said that, once they develop gestational diabetes, there is an increased risk of developing type 2 diabetes, or what we call as non-insulin dependent diabetes. Over a span of 10 years, for instance, there's 1 in 2 risk of developing.
So again, they have to do rigorous screening and follow-up, etc.
Lifestyle management, exercise, diet control.
Right. So one specific question, I don't know, is there any correlation of gluten and diabetes?
At this current juncture, there is a very indirect correlation one can make, because people with gluten intolerance, if they were to have what we call a celiac disease, because it's an autoimmune condition, it can be associated with type 1 diabetes, which is again an autoimmune condition. But yeah, it's not associated with type 2 diabetes at this moment. So to put it simple, yes, there is a tiny risk of developing a special type of diabetes or a rarer variety of diabetes called type 1 diabetes if they have gluten sensitivity.
So I think Shubda asked this question. The message is very clear that very small risk, especially if you are gluten sensitive or what you call as gluten allergy or that kind of thing. 2 important questions have come up, and I think this is something which is more of a myth. Can insulin harm you?
Well, let's go back to basics again. What is insulin? It is something which is deficient in the body, which you need to survive. And if you don't have it, you take it from outside. What happens when you are dehydrated? You drink water from outside. But insulin can't be drunk. It can't be taken in the form of a pill. So you don't have a choice but to take in the form of an injection. It is this very fact that it is an injection that people are scared of, rather than the fact that they have to take insulin. So that's something which we need to reiterate to the general public. Insulin does not harm you if it is required for you and if you take it. On the contrary, if you don't take it when you require it, if it were to be a type 1 diabetic, i.e. insulin deficient diabetic, then you can go into coma or even die. And if it were to be type 2 diabetic, i.e. theoretically not insulin dependent diabetic, but if you were to harbor diabetes for a longer period of time, if you don't take insulin when the doctor advises, then you're going to end up losing your eyes, kidneys, develop heart attacks, develop burning sensation of the feet, so on and so forth. So in essence, insulin does not harm you if you take it appropriately as asked by the doctor. But there are 2 things that one ought to be careful when taking insulin. Just like any medication, it has its own share of side effects. The side effect it can have is if you take in doses that ought not to be used in higher doses, then you can develop what we call as low blood sugar readings. So that can be an overkill, and that can cause problems to the patient. Last but not the least is it can cause some amount of weight gain. So these are the only 2 complications that one need to look for, i.e. weight gain and low blood sugar readings. Apart from these, there are no definite concerns that one need to have whilst using insulin.
You raised an important point about injection versus insulin, and I want to share this with the audience. I refused to treat my father for many years because he would not take his insulin on his own. He was on insulin 3 times a day. So, and he used to travel quite a bit. So every time he needed somebody to be there alongside with him to just administer that. So you can imagine that the compliance was very, very poor.
Yeah.
Now, at some point I told him, I'm not going to treat you. And then one day I said, I'm going to show you how to take insulin. If you start taking this, then only I will treat you. And if I look back, if there's one gift that I was able to give back to my father, which I am very proud of, is to teach him how to take insulin. Trust me, it is so simple, so simple. And with today's syringes and needles and the insulin pens, it has become far, far easier for each one of you. Those who have parents, those who have families, any of the members who is on insulin, here is my humble request. If you are in any of the cities where we are present, we can come home and teach you on how to take insulin, because this is something which we would like to give as a gift to your family. Or I would urge each one of you to just go and learn from the nearest nursing home or a nurse. It is such a simple thing. It doesn't require any medical skill to administer that. And anybody who's on insulin should not be dependent on anybody else for that insulin injection to be administered. Whether it is father, mother, grandmother, grandfather. No age is a barrier. It's just that sometimes with old age, you may not see the insulin readings properly. So you need somebody to tell you that this is it. And that also with the pens has become much, much more easier. So I think this is something I really want to reinforce with each one of you. Please educate your relatives or your family members on self-administration of insulin rather than being dependent.
There are a few, I think you raised a very valid point, Dr. Joshi. See, there are a lot of myths about insulin. It all starts from our parents telling a child, look, if you make a lot of noise, be mischievous, I'll make sure that I'll take you to a doctor and you get an injection. So the fear of injection stems from that word, which is used during childhood. So this fear grows and grows and grows, and the adult, when he needs insulin, is still scared of insulin. The second factor is the person who needs insulin would actually correlate or relate insulin being given to his or her grandmother or granny during their terminal stage of life. The problem there is they tend to ignore the fact that the grandmother died very sadly, miserably probably, because of the fact that insulin administration has been delayed, and he and she developed all the complications because of delay in giving insulin, not due to giving insulin because she is dying. So this factor is something that has to be sent into the public, that insulin is not a treatment at the end stage of life, but it has to be given when it has to be given. If it is given at the right time to the right individual, it can delay the complications of diabetes and prevent all that this individual must have seen happening to his grandmother or granddad, because in those days, insulin used to be used as a last resort during the terminal phase of life. And as you rightly mentioned, the third point, times have changed. Technology has changed. Previously, people who had dexterity problems, i.e. if they couldn't use configure things properly, they had to draw a syringe, take some insulin out of the vial, and then inject it. And it's all messy. Now it's no longer the case. Everything is filled. Just take a pen, dial the number, inject it, take it out. Once the pen is over, you can even throw it out.
So I think Dr. Ravi raised a very important point, and I want to just reiterate this, that is controlling blood sugar the goal in diabetes, or preventing the complications is the goal? So it's a tricky one. So your aim ultimately should be, no amount of sugar control is good enough if you are not able to prevent the target organ damage. Your goal ultimately is that you want to preserve the target organs, whatever it takes to ensure that. And the most important thing is early detection, regular lifestyle change, and discipline. This is what we talked about. Now, just following on to this, we talked about injections. There's somebody who's asked the question on insulin pumps. You want to just talk about that for a moment?
Yeah, because we were discussing about technology. Insulin pumps are again something which have come up over the last decade or so. And these are valuable tools in people who do have challenges managing their blood glucose levels in the optimal range. For instance, if there were to be a type 1 diabetic, or for that matter, even a type 2 diabetic who is on insulin. So in simple words, anybody who is needing insulin, and if they're having gross fluctuations of blood sugar levels, erratic, very high readings of say 400, 300, and also having readings of 40 and 50. Okay, these are wide extremes. They can be pretty challenging for the healthcare provider as well as for the individual to keep them under appropriate control. In such a scenario, it would be a very useful tool because it's a small gadget, something of the size of your mobile phone, which contains insulin, and it delivers insulin by means of a little tube which is attached to the tummy. So what happens is these wide fluctuations in the blood sugar levels and the dips of blood sugar readings can be prevented, and there can be good blood glucose control. Another case where we prefer to use this as a gadget and a means to deliver insulin to achieve successful outcomes is gestational diabetic individuals or diabetics who became pregnant. In such a scenario, again, it would be a great tool to ensure that insulin delivery is appropriate. Another scenario, which is rather rare, is challenging sports. People, if they were to play sports, endurance sports, and if they take it as a profession, such individuals would really benefit from insulin pump, because we can't afford to have our cricketers or tennis players or shuttlers to have blood glucose fluctuations of 300s and 400s, and again having dips because they are playing their sports.
So this is what I was told as a medical student, that fluctuations of sugar are far more dangerous than a steady high or a steady low. Is that correct?
Yeah.
To a large extent, right?
Any fluctuations can cause mood swings, can actually deprive the individual of confidence of managing blood sugars, can in fact cause detrimental problems such as ending up in coma if a person were to have a significant blood glucose reading. And in fact, studies have even shown that they have higher risk of cardiovascular mortality, i.e. deaths from heart attacks.
So you touched an important point, and I'm just about to think, is diabetes and 1, 2, 3, 4, which are these deadly combinations?
Well, in what none of us would want to die of any of the reason. You're asking me, shall we jump from the mountain cliff or drown in water?
So diabetes and hypertension, right? It's a deadly cocktail. Diabetes, hypertension, heart problem, another deadly combination. Diabetes, hypertension, heart problem, then you also have some kidney problem, another deadly combination. And isolation, first of all, you have to keep one illness in the body at one time as far as possible. And this illness, particularly diabetes, because it can affect so many organs, you really have to take care. The problem is, it is not painful. It doesn't give you immediate things like breathing difficulty, chest pain, etc., so that you will go and seek attention. All it probably makes you is a little restless, mood swings. Probably you have to use the bathroom a little more frequently, which we tend to neglect for quite some time. So I just want you to, in simple man's term, tell people either who are pre-diabetic or people who are diabetic, on how do they understand before a blood test that their sugars are probably going above 300.
It's a good question. So the question here is, who all need to get their blood sugars checked? If you're overweight, if you've got a family history of diabetes, i.e. if your father, mother, brother, sister, if they have diabetes, if you're not feeling well in yourself, in general, for any reason, if you're going to the loo more often, using the washroom more often, if you're waking up night times to go to the loo more often, if you are developing frequent infections such as thrush or what we call as candida infection, fungal infections, and if you have developed any unexplained wound which is not healing, because many people know that cuts or wounds don't heal that easily in people who have diabetes, or if you have unexplained change in your vision, these are all the symptoms that one should watch for, and if they have any of these symptoms or signs, then they need to seek medical attention immediately. Apart from this, if you're overweight, if you've got high blood pressure, if you've got a family history, as I already mentioned, it is very important to get periodic checkups of blood sugar, say every year, because it's a very simple test. It's not expensive. It costs probably 100 to 200 bucks, and that would give you valuable amount of information using which you can find out if you got diabetes or not.
So coming to a very simple, but I think it's a pertinent point, and somebody asked this also. Should they get a glucometer reading or should they do a lab test?
See, glucometers are useful tools, definitely, but they do have this 10% error. See, if somebody were to have a fasting blood sugar of, say, 120, which is definitely elevated in the pre-diabetic range, that means not quite normal, but not quite in the diabetic range. There is that zone which is not normal, which is not in the diabetic range. It is the middle area. These people, they can be sometimes misled if they use a glucometer to screen their for diabetes. But if they don't have access to lab, and if the only thing that they have access to is a glucometer, something is better than nothing. So use a glucometer. But if you do have access to lab, for screening purposes at least, it is better to use lab as a screening tool to get your blood glucose checked.
So just reinforcing Dr. Ravi's point, what he's saying is, if you're an established diabetic, then probably to monitor your levels, the glucometer is as good, because 10% here or there will not make a difference. But if you are somebody who is supposedly undergoing screening for diabetes, or who is pre-diabetic and wants to confirm whether it is diabetes, then probably to establish diagnosis, it would be better to do a good lab test. And otherwise also it makes sense, because you would probably also need an HbA1c alongside. So why do you want to have two pricks instead of in one prick? You can finish this whole testing.
Yeah.
So we are just about at 7:12 now. It's been 45 minutes. We've got some interesting questions. There is somebody who's asked, if patient is having diabetes, why doctor suggests reduce the sugar and then we will go for surgery in general? This is Abhijit Patki who has asked this question. Very pertinent question, and I think many a times we don't take time out to explain why we are saying. So it's a good opportunity to tell them.
Yeah, people who have high blood sugar readings have a lesser chance to go out of the hospital, as simple as that. If you ask me why that is the case, because they can have increased risk of infections. The wound healing process is very much delayed, i.e. the surgery may be successful, but the wound healing process might get delayed. They can get infections from the wounds of the surgical cuts. And last but not the least, they can even develop increased risk of heart attacks, so on and so forth, if it were to be a non-medical reason why they got, non-surgical reason for which they got admitted to the hospital. So in simple words, the chances of infection are high. The chances of the wound healing is less if they have high blood sugar levels. Hence, if it is a non-emergency surgery, it is better to get the blood sugar levels well controlled before you go for surgery.
So it's Abhijit answering to your question. What he's saying is told very clearly, and most of the surgeries actually have a scar or a wound, and you'll find that if the sugars are not in control, that usually gets infected. You have pus and other things developing. So it's very, very important to have good blood sugar level controls. Also, one other risk in any major surgery is the damage to kidneys. Because during surgeries we also have blood pressure fluctuating, etc. And along with diabetes, it can only compound the effect, and people land up in a serious problem. Rizwana asked, is there an insulin once a week going to be available this year or anytime soon?
Insulin once a week at this current juncture is not available, but we do have injections which can be used once a week. They're not quite insulin. They act in a different form and shape. They're called GLP-1 receptor agonists. It's quite a mouthful, but these injections can be used once a week to control blood sugar levels, and they're very much available in India as well at this current juncture.
So Rizwana, to answer to your question, Dr. Ravi is telling that there are injections which can be administered once a week.
Once a week.
They have to be used in certain specific situations, and they are available in India. I would urge you to connect with Dr. Ravi. If there is anything that he can facilitate, he'll be happy to do that.
Just an extension of it. In the near future, even in India, we're going to get inhaled insulin, which is available abroad at this current juncture. And we're expecting that insulins that act for 48 hours would be soon available. It is available in the market, but it is not licensed for 48-hour usage at this current juncture, although it acts for a good 48 hours.
So which means that the number of injections will come down one day for an individual. Somebody has raised a very common issue that happens with diabetics is frozen shoulder.
Yeah.
I think many times the diagnosis happens because of frozen shoulders. You want to throw some light on?
Yeah. People with diabetes can have a lot of musculoskeletal problems as well, such as problems with their shoulder, wherein they have difficulty moving the shoulder, very painful, restricted movements, and also problems with their feet, what we call as plantar fasciitis. When these scenarios happen, it is important to consult your care provider who can guide you to an orthopedician or a physiotherapist who can facilitate appropriate treatment in the form of physiotherapy or sometimes injections or further investigation by means of a telescopic test called arthroscopy, depending on the clinical need of that particular individual. Also, achieving a very good blood glucose control in such individuals is known to facilitate improvement of these conditions sooner.
So great, guys. I think we've covered most of the questions that were asked. Some of the questions people have asked in later have already been answered in our discussion earlier. I would urge all of you to go back to this talk. There is wealth of information, and I think collectively, if we can affect just 10 lives and detect few people, and also encourage some people to control their sugars better, make them aware about complications, we would have achieved the goal that we set out. I just want to quickly highlight some of the important things that came into the discussion. The first one is discipline. Discipline about your food, about your diet, about your medication, about your lifestyle, and discipline in every aspect. Somebody also asked, can stress cause diabetes? So
yeah, probably it can, because if you're stressed mentally, then obviously you don't take care of yourself. You don't exercise, you eat junk food, you don't eat the right kind of food, and stress and lack of sleep are known to in fact cause a lot of problems, including hypertension, including precipitating diabetes.
So it's an important comorbid factor. If you have that, you're likely to probably ask diabetes to come to your home, right? So we talked of discipline, then we also understood what is the fundamental difference between type 1 and type 2 diabetes. The type 1 is where it is insulin dependent, the type 2 is where it is non-insulin dependent. Then we looked at the important things about the target organs that get damaged, from brain to eye to heart, kidney, peripheral blood supply and nerves. And very important point raised by Dr. Ravi, that we must have a regular check beyond just blood sugars to look for target organ damage. Very, very essential. We have seen this many times when we just go to a general practitioner for review. They just adjust the medicine for the diabetes sugar part of it, but there is no emphasis on the target organ damage. So you must look at that part of it. Then we also addressed questions on gestational diabetes, etc. What are the important things? So 2 points that Dr. Ravi said. Any pregnancy needs to be planned, and particularly if it is pregnancy-induced diabetes, then the delivery and all other things around that has to be very well planned. And every pregnant woman must undergo screening for gestational diabetes.
Absolutely.
Right? And then, obviously the common questions in terms of diet and other things, which he reinforced in saying that anything which is rich in carbohydrate, the quantum of that definitely needs to come down. He also suggested,
especially if it is simple carbohydrate, if it is easily absorbed.
Yeah. So, and just like a physician is important in your care, I think a dietitian working with you side by side will, at the end of the year, reduce the amount that you spend on medicine. That's very important for all of you to know. And then we also looked at some of the recent things in terms of insulin pump and other things, and then people had questions on frozen shoulder, etc. that we've answered. Ravi, you want to summarize anything else? You want to give a message on this World Diabetes Day?
See, at the end of the day, if you want to take care of yourself, live happily and healthily, You need to have a disciplined life. Do everything in moderation. Let it be exercise, let it be eating, let it be sleeping, let it be work. Don't take stress home. Live happily, live healthily, you'll be fine.
I'm sure a lot of people are watching us who also would like to have a comment on what about drinks?
Yeah, it's an altogether different topic. You can enjoy the odd drink, but don't overdo anything. Drinking once in a while is not going to put you to risk of diabetes, but if you overdo anything, then you're going to put yourself to risk of diabetes, liver problems, so on and so forth.
All right, guys. I want to thank each one of you for joining us, and particularly want to thank Dr. Ravi for having taken out time from his busy schedule. He has had a busy day since yesterday because it's the World Diabetes Day. Thank you so much for joining us. Do keep on, liking us on our Facebook page. We have some more interesting and relevant healthcare-related talks coming up, and our intent is to keep it as simple as possible for the layman. And if you have certain topics that would interest you, your relatives, friends, etc., please do join us on FB Live at Apollo Home Care. Thank you so much for joining us. Thank you, Dr.
Pleasure, Enrique. Pleasure.